Hello everyone, and welcome to Pulse Check, where we dive deep into the most pressing health issues of our time. Today, we're taking on a topic that is as urgent as it is universal: global mental health. Mental health is the foundation of our well-being, productivity, and resilience. It influences how we think, feel, and interact with the world. Yet, despite its importance, mental health remains one of the most neglected areas of healthcare worldwide. Today, we'll explore the state of mental health, the challenges we face, the treatments that work, the consequences of inaction, and the steps we must take to build a mentally healthy world together. The global and North American mental health landscape. Across the globe, mental health disorders affect nearly 1 billion people. That's 1 in 8 individuals grappling with conditions like depression, anxiety, PTSD, schizophrenia, and substance use disorders. Here in North America, the numbers are just as striking. In the United States, 21% of adults, 50 million people, experience a mental health condition annually. Among youth, 1 in 5 teens face a diagnosable mental health disorder each year. In Canada, 1 in 3 individuals will experience mental health challenges in their lifetime. These aren't just numbers, they represent lives, families, and communities affected by unmet mental health needs. And the COVID-19 pandemic has only deepened the crisis. Rates of anxiety and depression surged globally by over 25%, leaving millions struggling to cope with isolation, loss, and uncertainty. The high cost of inaction: when mental health conditions are left untreated, the consequences can be devastating for individuals, families, and society as a whole. For individuals, untreated mental health conditions can worsen over time, leading to chronic physical health issues like heart disease, diabetes, and immune system dysfunction. Suicide, often the tragic result of untreated mental illness, claims 48,000 lives annually in the U.S. alone. Among young people aged 15-24, it is the second leading cause of death. For society, untreated mental health disorders can lead to homelessness, substance abuse, and incarceration. In the U.S., 37% of incarcerated individuals have a diagnosed mental health condition. Public safety concerns also arise, as untreated conditions can escalate into crises requiring emergency interventions. Economic costs. Globally, untreated mental health issues cost $1 trillion annually in lost productivity. Absenteeism and presenteeism, when individuals are physically present but mentally unwell, hurt workplaces and economies alike. The message is clear: the cost of ignoring mental health is far greater than the cost of addressing it. Effective treatment options. What works today? Thankfully, we have more tools and evidence-based approaches than ever before to address mental health challenges. Psychotherapy, talk therapy, cognitive behavioral therapy, CBT, the gold standard for treating depression, anxiety, and PTSD. Studies show CBT can reduce symptoms by 50%, 70%. Other therapies, like dialectical behavior therapy, DBT, for borderline personality disorder and trauma-focused approaches, offer life-changing results. Medication. Antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, are effective for depression and anxiety. Antipsychotics, essential for managing schizophrenia and bipolar disorder. Combined with therapy, medications improve recovery rates by 60%, 80%. Emerging treatments. Ketamine therapy, rapidly effective for treatment-resistant depression. Transcranial magnetic stimulation, TMS, a non-invasive therapy showing promising results for severe depression. Psychedelic-assisted therapy. Clinical trials using substances like psilocybin are demonstrating groundbreaking success in treating PTSD and depression. Lifestyle interventions. Exercise, mindfulness meditation, and nutrition-based approaches complement traditional treatments. Regular exercise alone can reduce symptoms of depression by 30%. Digital and community-based solutions. Telehealth platforms like BetterHelp, Talkspace, and Canada's Wellness Together offer accessible therapy for underserved populations. Community-led programs, such as the Friendship Bench in Zimbabwe or Indigenous-led healing initiatives in Canada, deliver culturally sensitive care. Crisis interventions. The 988 Suicide and Crisis Lifeline in the U.S. is a pivotal resource, providing immediate support 24/7. Mobile crisis response teams are now replacing police in mental health emergencies, ensuring safer and more compassionate outcomes. What must be done? Turning knowledge into action to address the global mental health crisis, we need a coordinated, multifaceted approach. Scale access to care. Expand evidence-based treatments to underserved communities, leveraging telehealth and task shifting to train lay health workers. Break the stigma. Normalize mental health conversations through public education campaigns. Programs like Mental Health First Aid can empower communities to provide compassionate support. Invest in prevention. Early intervention is critical. Mental health screenings in schools and primary care settings can identify issues before they escalate. Increase funding. Currently, mental health receives just 2% of global health budgets. Governments must prioritize mental health funding to address workforce shortages and expand services. Foster collaboration. Public-private partnerships and cross-border collaborations can share resources, research, and best practices to create scalable, sustainable solutions. A call to action. Let's make mental health a universal priority. Improving mental health isn't just about treating disorders, it's about creating environments where people can thrive. It's about treating mental health with the same urgency and respect as physical health. Each of us has a role to play. Whether you're an advocate for equitable policies, a supporter of local programs, or simply someone starting conversations to challenge stigma, your actions matter. At PulseCheck, our mission is to bring these critical conversations to the forefront, inspire action, and equip you with the knowledge to make a difference. If today's session has resonated with you, I encourage you to subscribe to PulseCheck. By subscribing, you'll gain access to expert insights, inspiring stories, and actionable resources to stay informed and empowered. Together, we can build a world where mental health is a universal priority. Together, we can ensure no one is left behind, no mind is untreated, and no voice is unheard. Thank you for joining today's PulseCheck. Let's commit to leading this change, because the time to act is now.